Remember when doctors made house calls? It wasn't that long ago. Healthcare used to be more personal. Doctors knew their patients. They lived in the same towns. They understood their patients' lives. Healthcare was also more affordable. People paid for many services out of pocket, but costs were generally manageable. It was a different time. This personal, affordable approach to healthcare began to change in the early 20th century. Hospitals became more advanced. New treatments and technologies emerged. These advancements came with a price tag. Healthcare was becoming more expensive. As hospital costs rose, a new idea emerged: health insurance. This concept was revolutionary at the time, offering a way for people to manage the financial burden of unexpected medical expenses. Before health insurance, many families faced financial ruin when confronted with high hospital bills. People paid a small amount regularly. These payments were often affordable, allowing even those with modest incomes to participate. The idea was simple yet effective. By contributing a little each month, individuals could protect themselves from the potentially devastating costs of medical care. These payments went into a collective pool. This pool of money was managed by the insurance company, which would then use it to cover the medical expenses of its members. The pooling of resources meant that the financial risk was spread across many people, making it more manageable for everyone involved. If they needed expensive hospital care, the pool would cover the costs. This system provided a safety net, ensuring that individuals could receive the care they needed without worrying about the financial implications. It was a significant step forward in making healthcare more accessible and equitable. The first private health insurance plans emerged in the early 20th century. These early plans were often offered by employers as a benefit to their workers, helping to attract and retain employees. Over time, the concept of health insurance grew in popularity and became more widespread. These plans helped people manage the rising cost of healthcare. As medical technology advanced and treatments became more sophisticated, the cost of healthcare continued to rise. Health insurance provided a way for people to keep up with these increasing costs, ensuring that they could still access the care they needed. However, this also marked the beginning of a shift. The introduction of health insurance changed the way people thought about healthcare. It was no longer just a personal service provided by doctors and hospitals. It was becoming a business, with financial considerations playing a larger role. Healthcare was transitioning from a personal service to a business. Hospitals and healthcare providers began to focus more on the financial aspects of their operations, looking for ways to increase revenue and reduce costs. This shift had significant implications for the way healthcare was delivered and received. Hospitals, once charitable organizations, began to operate more like businesses. They started to adopt business practices, such as marketing and financial planning, to ensure their survival in a competitive market. This change was driven by the need to generate revenue to cover the increasing costs of providing care. Their focus shifted towards generating revenue. This focus on financial performance sometimes led to difficult decisions, such as cutting services or increasing prices. While these changes helped hospitals stay afloat, they also had an impact on patients, who often faced higher costs and reduced access to care. This shift set the stage for the healthcare system we know today. The rise of health insurance and the transformation of hospitals into businesses have shaped the modern healthcare landscape, influencing everything from the cost of care to the way it is delivered. Understanding this history helps us appreciate the complexities of our current healthcare system. World War II had a profound impact on healthcare in America. With millions of men away fighting, businesses faced labor shortages. To attract and retain employees, companies began offering health insurance as a benefit. This decision had unintended consequences. It tied healthcare to employment. This system became deeply ingrained in American society. Today, most Americans receive health insurance through their employers. This link between employment and healthcare creates challenges. People who lose their jobs often lose their health insurance. It also limits employee mobility, as people hesitate to leave jobs with good health benefits. The decades following World War II saw the growth of a powerful healthcare industry. Private insurance companies expanded, offering a variety of plans. Hospitals grew in size and scope, investing in the latest technologies. The pharmaceutical industry boomed, developing new drugs and treatments. This growth, while providing advancements in medical care, came at a cost. Healthcare became a lucrative business. Insurance companies sought to maximize profits. Hospitals competed for patients and revenue. Pharmaceutical companies aggressively marketed their products. The focus, for many players in the system, shifted from providing care to generating profit. Section 5. Government steps in. Medicare and Medicaid. In the 1960s, the U.S. government took a significant step in healthcare by establishing Medicare and Medicaid. These landmark programs were part of President Lyndon B. Johnson's Great Society initiative aimed at eliminating poverty and racial injustice. The signing of the Medicare Act on July 30, 1965, marked a pivotal moment in American history, symbolizing a commitment to providing health care for all citizens, regardless of their financial status. Medicare provided health insurance to seniors over 65, ensuring that the elderly, who often faced high medical costs and limited income, had access to necessary medical services. This program was designed to cover hospital care, medical visits, and other essential health services, significantly reducing the financial burden on older Americans. While Medicaid aimed to cover low-income individuals and families, offering a safety net for those who could not afford private insurance, Medicaid provided comprehensive coverage, including hospital stays, doctor visits, long-term medical care, and more, ensuring that vulnerable populations had access to the health care they needed. These programs were created to ensure access to health care for vulnerable populations. They represented a significant shift in the role of the federal government in healthcare, emphasizing the importance of health as a right rather than a privilege. However, they also had unintended consequences. The rapid expansion of these programs led to increased government spending and complex regulatory requirements, which sometimes created challenges for healthcare providers and patients alike. Medicare and Medicaid injected billions of dollars into the healthcare system. This substantial financial support helped to stabilize hospitals and clinics, particularly in underserved areas, and provided a reliable source of income for healthcare providers. This influx of funds further fueled the growth of the healthcare industry. Hospitals expanded, new medical facilities were constructed, and the overall capacity of the healthcare system increased to meet the growing demand for services. Hospitals and healthcare providers now had another revenue stream: the government. This financial support allowed them to invest in new technologies, hire additional staff, and improve the quality of care provided to patients. While these programs provided essential care, they also contributed to the rising cost of healthcare. The increased demand for services, coupled with the administrative costs of managing these programs, led to higher overall healthcare expenditures. As a result, the cost of healthcare continued to rise, posing new challenges for policymakers and healthcare providers. Balancing the need for comprehensive care with the financial sustainability of these programs remains an ongoing issue in the American healthcare system. Section 6. Spending more, getting less. A troubling paradox. The United States spends more on healthcare than any other developed country. Yet despite this massive spending, our health outcomes lag behind other nations. Americans have lower life expectancies and higher rates of chronic disease compared to many other developed countries. This paradox is a serious concern. There are many factors contributing to this disparity. These include high administrative costs, a focus on treatment over prevention, and inequities in access to care. Another contributing factor is the profit-driven nature of the healthcare system. Section 7. The high cost of care. A heavy burden for Americans. The high cost of healthcare places a significant financial burden on many Americans. Medical bills are a leading cause of bankruptcy. People often delay or forego necessary medical care due to cost concerns. The fear of medical debt is a constant source of stress for many. Even those with health insurance are not immune to these challenges. Rising deductibles, co-payments, and out-of-pocket costs make healthcare increasingly unaffordable. The current system is simply unsustainable. Section 8. The profit motive. At the heart of the matter. At the heart of America's healthcare crisis is the profit motive. This underlying drive for financial gain influences every aspect of the system, creating a complex web where the primary focus often shifts from patient care to revenue generation. The consequences of this shift are far-reaching and deeply troubling. Every step in the healthcare process, from insurance premiums to hospital charges to drug prices, is driven by the desire to maximize profits. Insurance companies set premiums and deductibles at levels that can be unaffordable for many, while hospitals and healthcare providers often charge exorbitant fees for services and procedures. Pharmaceutical companies, too, play a significant role by pricing medications at rates that can be out of reach for those who need them most. While innovation is important, it should not come at the expense of affordability and access to care. Medical advancements and cutting-edge treatments are vital for progress, but they must be balanced with the need to make healthcare accessible to all. The challenge lies in finding a way to foster innovation without creating barriers for patients who are already struggling to afford basic care. We must ask ourselves, who benefits from the current system? Is it the patients who are supposed to be at the center of healthcare? Or is it the corporations and executives who profit from the status quo? This question is crucial as we consider the future of healthcare in America. Is it the patients who struggle to afford care? Families who face financial ruin due to unexpected medical expenses? Elderly patients who must choose between medication and other essentials? These are the real faces of the healthcare crisis, and their stories are often overshadowed by the financial interests of powerful entities. Or is it the insurance companies, hospitals, and pharmaceutical companies that profit from their illnesses? These organizations wield significant influence and resources, often prioritizing their bottom line over the well-being of patients. Their role in shaping healthcare policies and practices cannot be ignored. These are tough questions that we need to confront. As a society, we must engage in open and honest discussions about the true cost of our healthcare system and the values that should guide it. Only by addressing these fundamental issues can we hope to create a system that truly serves the needs of all Americans. Section 9. A Call to Action, Rethinking Healthcare for the Future. The time has come to rethink healthcare in America. We need to move away from a system driven by profit and towards a system that prioritizes people. This requires a fundamental shift in our thinking. We need to view healthcare as a right, not a privilege. Let's start asking the tough questions. Let's demand transparency in healthcare pricing. Let's explore innovative solutions that put patients first. The future of healthcare depends on it.